Good afternoon. The Prime Minister, COVID ministers and officials have been meeting this morning. The news that I have to share at the moment is positive. At this stage, there are no additional cases in the community connected to the new Auckland case that we identified yesterday. But more importantly, the new case has now been directly genomically linked to the recent case of a defence worker from the jet park who spent some time in locations close to where this new case worked. That direct link means that the new case doesn't point to an unknown border incursion that could be spreading, and it also means the risk of wider unseen spread is less likely, though we do want to increase testing over the weekend and in the coming weeks to give ourselves greater assurance on that. New Zealand, including Auckland, remains at alert level 1. The CBD in Auckland will be reopened and people can return. Events can take place, but we are asking that people act with caution as we continue to assess the risk of potential spread of any of the current cases. I'll now pass to Dr. McElnay to provide an update on the new health information that we have to hand and to talk about testing. I'll then set out some of the decisions and further instructions that we'll be putting in place. Dr. McElnay.
Thank you, Minister. There are 4 cases of Covid-19 to report in New Zealand today, all in managed isolation. 1 involves a recent arrival and 3 are classified as historical. There are no new cases in the community. I will provide details on the cases from managed isolation shortly, but first I want to provide an update on the Auckland community case that we announced yesterday. It's really encouraging news that overnight whole genome sequencing from this case has indicated an identical genetic profile to the sequence found in the Auckland managed isolation worker that we've been referring to as Case A. In addition to this, testing of 3 close contacts have come back negative, a work contact and 2 social contacts. Now we have this information, we can have greater assurance around the nature of this case. Working with our public health officials in Auckland, we are now investigating the source of any potential link in the movements of these 2 cases, people that they may have met or places they may have visited. And just on testing, yesterday there was an increased demand for testing across Auckland's testing network. This includes community testing centres, general practice and urgent care clinics. The 2 pop-ups in the central city were busy yesterday and it's the same today. 4 additional testing stations have been stood up: City Centre Community Testing Centre, Victoria Park Community Testing Centre, the Doctors Key Med Britomart Community Testing Centre, and Wynyard Quarter Car Park Community Testing Centre. Existing community testing centres and GP clinics around the Greater Auckland area continue to provide testing services and report steady volumes. And a full list of the testing sites in Auckland is available on the Auckland Regional Public Health website. And to reiterate, anyone in the Auckland area, and indeed throughout New Zealand, who has cold or flu symptoms should get a test and stay at home until you have a negative test result. In addition to the testing advice that we provided yesterday, which still remains current, we are now asking that if you were in Auckland CBD at locations of interest, that those people get a test regardless of symptoms. Those places include the Metsy Bar on the 5th of November, Red Pig Restaurant on the 7th of November, Sunnytown China Taste Restaurant on the 9th of November, Auckland City Doctors on the 10th of November, and the AUT Student Hub on the 10th of November. There are more locations and times which are will be on the Ministry of Health and the Auckland Regional Public Health Centre website. We are implementing an enhanced surveillance process which will include dates from the 3rd of November, and those particular locations will be on the website. Auckland DHB is also continuing to closely monitor demand and capacity for testing outside the CBD. And there are a number of urgent care and after-hours clinics in Botany available for testing, and a CTC will open in Botany tomorrow. There will also be a CTC Community Testing Centre open in West Auckland throughout the weekend, in addition to the 2 centres open regularly in West Auckland on weekdays. And for push notifications, yesterday the Ministry sent out 11 push notifications relating to 7 locations visited by the latest confirmed case. As of 10 a.m. this morning, 51 NZ COVID Tracer app users have received contact alerts from these notifications. The contact alerts for A to Z Collection, the Vincent Residences and Red Pig Restaurant advised app users to isolate and call Healthline to arrange a test. The alerts for the other 4 locations advised app users to contact Healthline if they develop any COVID-19 symptoms. And just a final bit about numbers. As I said, we have 4 cases to announce today, 1 recent arrival and 3 historical cases. The recent arrival arrived from the Philippines via Hong Kong the 31st of October. They tested positive at around day 12 routine testing and are now in the Auckland quarantine facility. The 3 historical cases tested positive in their managed isolation facility, but on further investigation were determined to be historical and are classified as recovered, and more details about them will be on the Ministry's website. 4 previously reported cases have now recovered, meaning our total number of active cases remains at 53. Our total number of confirmed cases is now 1,639. Yesterday, our laboratories completed 7,226 tests for COVID-19, bringing our total number of tests to date to over 1 million. And just lastly, about the NZ COVID Tracer, there are now over 2 million registered users of the app. Poster scans have reached 113 million, and there have been almost 5 million manual diary entries. From our statistics, we can see that fewer than 1 in 6 of the 2.3 million registered with the app are using it daily. We really want to emphasise how important it is that we all scan the QR codes whenever we see them. The more we scan, the safer we all will be. We really can't afford to get complacent. We have seen that despite our robust border controls, the virus can emerge anywhere in the community at any time. Taking a few seconds to scan in with the app means that we can quickly inform you if you have been exposed to the virus, so that you can take steps to protect yourself and your whānau. It also means if you test positive for the virus, you can instantly provide your digital diary to contact tracers, and that gives us a massive head start. The faster we can contact trace, the quicker we get ahead of the virus and prevent spread in the community. Thank you.
Thank you, Dr. McElnay. These recent events have highlighted just how important all of our ongoing vigilance is. COVID-19 continues to rage around the globe, and if we're to continue to enjoy the very fortunate position that we find ourselves in here in New Zealand, we all need to continue to take action to keep ourselves and to keep others safe. We don't yet have a confirmed theory for how the virus was transmitted between the cases that we're currently dealing with, and we're not in a position at this stage to completely rule out other as yet unidentified cases flowing from that. That's why we're standing up the surge testing capability today and over the weekend. It's also why we're asking everybody to continue to take precautionary steps to keep themselves and to keep others safe. We've got government support in place for people who may not have access to sick leave, and we do ask all employers to ensure that sick workers stay home. You should not knowingly allow your staff to come to work if they're sick or if they're required to self-isolate whilst they're awaiting a test result. It's in all of our interests, but it's especially in businesses' interests that our CBD and our businesses can stay open, and our ongoing continued vigilance is vital to that. We also need individuals who've been asked to self-isolate until they've received a negative test to do so. I've been advised of reports this morning that people were seen coming and going from the Vincent residence, and as a result of that, public health protection officers have been put in place this morning to better secure that building. Again, we cannot beat the virus if people don't keep doing the right thing. An update on testing numbers there. I've been advised that as of this morning, 173 people from the apartments have been tested. 101 negative results have come through so far, and 72 are still pending. We're asking everybody who uses public transport in Auckland to continue to wear a mask. We don't yet know how many cases there could be out there, so we need to continue to act with an abundance of caution. On Monday, I will be taking to Cabinet a public health order to make mask use on public transport within the Auckland region mandatory on an ongoing basis. This will include the wearing of masks on all passenger aircraft that travel domestically within New Zealand. I also urge everyone to be vigilant in scanning their QR code as they're entering places. I urge businesses to ensure that QR codes are visible and to be active in encouraging customers and patrons to scan in. It helps enormously with the speeding up of contact tracing and helps us to get ahead of the virus. I will be considering in the coming days how we can continue to strengthen our contact tracing system using the COVID Tracer app. That may include making it mandatory for people to scan into businesses or events in certain circumstances, for example, at large gatherings or at hospitality venues where social distancing isn't possible. I will take further advice to that, on that to Cabinet in due course. So in summary, our response to this latest case is ongoing. Our plan is rolling out, and that includes increased surveillance testing and surge capacity over the coming days, mask wearing on public transport and planes, and we encourage people to use that in public spaces where social distancing isn't possible, for example, at large public events, and scanning QR codes wherever people go. And all of the usual public health advice continues. Stay home if you're sick, maintain good hand hygiene, and think about others. I do want to end with two very important messages. The 4 cases that we've been talking about, cases A, B, C, and now D, understandably feel the weight of the entire country on their shoulders at this point. As we've said repeatedly, it is the virus that's the problem and not the people. They do not deserve to have blame heaped upon them. They need our support. Please be mindful of their privacy and how they are feeling. I encourage everybody to put themselves in their shoes. It could be any one of us that finds ourselves in this situation. Being in the eye of the storm can actually have a big impact on people's concentration and their ability to recall information at a time when we are relying on them to be able to do that. So we need people to give them space so that they can participate in the contact tracing process and give us all the information we need in order to be able to do our jobs. Offer encouragement and not anger. This is not their fault. Be kind. We are all in this together. Finally, I want to take a moment to say a special thank you to all those who are working at our border. They are some of the great heroes of our COVID-19 response. Our border workers are among the most scrutinised and the most tested people in the country. They are doing an incredible job day in, day out, keeping COVID-19 out of our community. So on behalf of all New Zealanders, thank you to our border workers. While they may not feel it all of the time, we are truly grateful for the sacrifices they are making, for their professionalism and for their compassion. And on that note,
if you're talking about an abundance of caution, why are you reopening the city and allowing events to go ahead this weekend, which we know are high risk?
So we are at alert level 1. What we have indicated, and I think we've set it out, is where we think the risk lies. This is not the level of risk at this point that would trigger a higher alert level, but we are asking people to take extra precautionary measures, like mask wearing on public transport, like mask wearing in big public events where that's appropriate, like really being vigilant about tracing their contacts.
So do you want people to wear masks at those events if they're out in the public with people they don't know?
If they are socialising with people they don't know, a very sensible thing to do is to wear a mask in an abundance of caution. It keeps everybody safe.
less willing to lock down or shut down than you were a couple of months ago because of the economic impact?
No, what we've been working on all the way along, and I've spoken about this over the last sort of 5 months that I've been working in this area, we've been working on strengthening our testing, our contact tracing, our case investigation processes, because they've got to be our first port of call. We want to have, further escalation of alert levels, the last port of call for us. We want to make it as much as possible a process that's contained, where we're containing, the virus as quickly as possible. And the evidence that we've seen in the 5 or 6 recent cases where we've had to deal with this is that those systems are working very, very effectively. Probably the key difference yesterday was that it's taken us a little bit longer to assemble some of that information. We've made a commitment right the way through this to be as transparent as possible around sharing the information we get as close to when we get it as possible. But that will mean that from time to time there'll be some missing pieces of the puzzle. It will come, Jess.
With the St Vincent or the Vincent Street apartments, are you saying that people have been coming and going from there? And why did you only put in public health people this morning? Wouldn't it have been a no-brainer to do that as soon as you knew?
My understanding was that the public health were going to be there last night. It became apparent early this morning that there weren't people at the front door there this morning. And so as soon as I became aware of that, we got on the phone and made sure that happened. The testing was happening last night. There was sort of clear guidance that there should have been additional support there. When it became apparent that somewhere along the way, those people had left, we made sure that we had people back there.
How damaging could that be, though? This is a hot spot that you identified yesterday.
Look, the risk for the apartments is still relatively low. The fact that you live in the same building as someone who happens to have tested positive for Covid-19 does not necessarily increase the risk for you. So again, these are very, very precautionary steps that we're taking. As you will see from the testing results, the first batch of testing results are in. That's very encouraging, what we're seeing.
Do we know that there has been transmission in those common areas, such as, for example, the lifted ridges or the rubbish bin in the Crown Plaza? How disappointing is it that the security wasn't there last night?
Look, it would have been nice if it was there right the way through, but we've resolved that as quickly as we could once we became aware that there weren't people out front today.
How direct is you said case A and D have a direct genomic match? Does that show that there is no missing link between them, that case A infected case D?
I'll get Dr. McElnay to speak to the science. The science can't be exactly that precise, but it shows, if you look at the genome is a good clear match, and if you look at the time frames, it would suggest that a long train of transmission wouldn't be possible within the time frames that we're talking about. But again, I'll let you speak to the science.
No, I agree with the Minister's comments. The genomic sequencing have been reported as identical. So that certainly is consistent with a straight transmission from A to D. From a pure science, it doesn't exclude the possibility that there might be another intermediary. But then when you look at the timing of events, the incubation period, exposures, that all fits time-wise with a straight transmission.
In that context, you're happy to lift those restrictions in the CBD?
But look, that's one of the things we look at. We look at whether, is there likely to be a clear chain of transmission? It would appear on the evidence that we've got now that seems to be fairly clear. As with all things, though, and I can't reiterate this enough, we always get more information. We're always reviewing what we're doing based on new information that we get. Nothing is ever final or locked in. If new pieces of the puzzle come to light, then we take action based on those.
Can you clarify, when you talked about masks, you said that all public transport in Auckland and then on aeroplanes flying domestically.
Yes.
Is that just in and out of Auckland
No,
or everywhere?
that will be airlines flying all over. Planes.
Mask wearing now on aeroplanes?
Well, assuming the Cabinet agrees with that recommendation that the Prime Minister and I will be making on Monday, yes.
When would that? One of the rumours that's circulating is that the infection could have come from use of a public toilet. Can you shed any light on that?
So the investigation work that I have seen so far, or the feedback that I have had so far, hasn't been able to establish that link. There do appear to be, while the premises are close, there do appear to be separate toilet facilities for the two premises in question, so the bar and the shop. They do have separate toilet facilities. But again, investigations continue, but the speculation yesterday hasn't proven to be a conclusive a link at this point. We'll come over to that here.
Why do nurses in managed isolation quarantine facilities still do not have consistent access to N95 masks. The Nurses Union says it is a breach of the Health and Safety Act and nurses are considering taking action. What is your reaction to that?
So I have asked for further advice on the use of N95 masks. The public health guidance up to this point has been that regular surgical masks are the most appropriate for use in those facilities. I have not yet received the advice on N95 masks, so I'll ask Dr. McElnay whether she wants to comment on that.
Only in that the advice is in preparation.
That's right.
Yes.
Say that the difference in alert level response to August and now is circumstantial in that the person now lived alone, very little mingling, whereas the people that were first infected back in August had a family and did a lot of mingling. Is that a fair characterisation?
There are a variety of different things about this this most recent group of cases that we're dealing with. The first is that we had more information early on this time around than we did last time. We already knew when we made the decision to move up the alert levels last time that there were more cases probable and on the way, which we didn't have this time. We were able to quickly get the testing done, the genomic sequencing done overnight, which certainly helped us in helping to put the puzzle together. And so I think that's given us a greater level of comfort. So the circumstances, we always look at what we know about any individual case at any given time, and when we make decisions based on that.
Can I also ask, why does it take this near crisis to make mask use and QR code scanning mandatory? Like, people have been calling for this for weeks, if not months.
Look, we're always reviewing our settings. We last reviewed our settings around mask use as a result of the Auckland cluster that we dealt with, the Auckland August cluster that we dealt with, and when we stepped down the alert levels, we did consider mask use at that time, and obviously we've continued to keep that under review, and we're now making further changes based on that.
Why don't we come to here? Yeah. Why is the sort of proposed mask mandate just for public transport in Auckland? Why not Wellington and Christchurch, which also have an IQ?
So I should have been clear. Auckland at this point, but we will be looking at other areas, and whether or not we differentiate other parts of the country as well. So, for example, would we consider that being the case in any cities or areas where there are managed isolation facilities or airports that might be serving international passengers? So those things will be considered over the next week or so, but I'm just making the announcement around what I'm recommending for Auckland and for plane travel. I'll be taking that directly to Cabinet on Monday. We will be considering those other issues as well, but I haven't got a specific time frame on those yet.
The reason that you're targeting the Auckland and the plains because, to curtail any potential community cases that might still be out there from the November cluster, and the other stuff comes later.
That's right. So there's a more immediate need around Auckland and then around plane travel, obviously. Bearing in mind, as I said yesterday, we're a very, very mobile country. People get around quite a lot. And so we want to contain, risk as much as we possibly can. But then we will look at other areas where there could be further risk that should also be mitigated.
Just on the mask mandate,
yeah.
If Cabinet does agree, when would that come into effect, and would it be permanent or just for a set time or what?
So we are asking people to do that now, although I do want to be clear that that's not a legal requirement at this point, because until an order is in place it is not a legal requirement, but we're asking people to do that now, and the feedback we've had from the airlines is that they will work to ensure that people have a supply of masks where they need it. The order, an exact commencement date for the order will be announced after Cabinet on Monday once we've made those final decisions, but it will be within the next week.
Sorry, will it be permanent? Or for
it will be enduring, it will be ongoing. Nothing is ever permanent, but it certainly will be ongoing for the time being. We'll come back here.
Given you're looking to reduce that margin of risk there, why not call a Cabinet meeting today and push it through?
Look, we're asking people to continue to wear masks. What we've seen is that we've got a good degree of goodwill towards that. If you look today, for example, at what we asked Aucklanders to do today, we saw a very high degree of compliance with that. If I was worried that there wouldn't be a high degree of compliance with that, then we might be taking more urgent action there. We'd also have to consider, when we do make it mandatory, compliance, and how we enforce that, and that takes a few days to work our way through that.
Urgency around that.
No, I'm not saying that. I wouldn't be asking people to be wearing masks over the weekend if we didn't think it was urgent. Yes.
Can I just clarify something around the asking people to get tested? You listed things like the Metsi Bar and the Auckland City GP. Do you just want people to get tested who visited on those dates, or anyone in November?
No, it's on those dates, and the details are on our website.
Why ask people only who visited on those dates? Because isn't there evidence internationally that it can last on surfaces for a long time? If you're asking people to take the drastic measure of getting tested, why not cast a wider net?
Well, the evidence around lasting on surfaces is actually not for a long time. It's generally a shorter period of time. What we're doing here is trying to cast the net wider in case there might be some other unidentified cases. We have a current hypothesis of a link between case A and case D. We just want to make sure that there aren't some other cases, and by being specific about places, it allows us to be more targeted, but at the same time doesn't completely overwhelm our system with a lot of people being tested. So it's a balance between looking for the virus where we expect to find it, and actually being able to manage the system.
If I could add to that, the last time we had a big surge of testing where we got up to about 26,000, tests a day, that did slow down the processing. So while the labs were working around the clock to process them, it did mean that some of the urgent ones perhaps didn't always get to us as quickly as we needed them to. We've got two questions over here.
No, there are some concerns some working at Auckland Central testing stations are not wearing those N95 masks, but also that the stations are badly understaffed. Does that meet your expectations?
I would have to look into the details of that. That's not information that I've been aware of.
Do you think that 2 nurses at a testing station is enough?
Certainly, the testing stations operate in different ways, so I'm not able to give a blanket answer as to the number, but my expectation is that the DHBs would be providing sufficient people and providing sufficient PPE to support those nurses.
Come up the back.
Dr. McElnay, you just mentioned that you had the hypothesis between how the latest case was infected. Can you share what that is?
Well, our hypothesis is that there is a fairly direct link between the case A and the case D. That's primarily because of the genome sequencing, which is identical. What we still have to ascertain and is what we as epidemiologists look for is actually the history that case A and case D had a meeting together, were in the same place at the same time. That's what we're going through, the histories of both individuals to see if we can get that match. At this point in time, we've not actually been able to ascertain that, other than the very specific area of Auckland that they both were in.
Sorry, you don't have a specific thing of, say, a cafe table or an area that they may have bumped into each other?
No.
Okay, we'll come over the far side here.
How are you ensuring that the testing is reaching to the homeless communities, those living rough in the CBD?
There are a number of widespread number of testing stations set up, so certainly the availability is there. And
for homeless, like how are you reaching into those and ensuring that you're getting the numbers from those that are sleeping rough in the CBD? What are you doing specifically for them?
Well, that would be the Auckland District Health Boards and the Northern Regional Alliance to ensure that any individual is actually receiving that message and is supported to get tested if they need to get tested.
Is it a concern at all?
Are you considering any changes to the eligibility of the Covid-19 leave scheme?
Not at this point, no.
Would the case D, would they have qualified under the scheme, given that they were told to isolate by a member of the testing centre?
My understanding is yes, but I'm happy to go back and check that.
Information about that. We've seen media reports about the management of that retail shop pushing back on the suggestion that they encouraged the worker to come in when they were told. Has there been any different information given to officials about that interaction or what actually happened there?
My understanding is that there hasn't been any additional information other than what we had yesterday and what we have subsequently seen, in terms of media commentary from the manager.
How concerned are you at all about there being no sort of obvious connection between case A and case D at this point, and if it is phone-like transmission, which is very rare, how do you feel?
Well, I can tell you what I think, and then obviously we'll go to the health experts. But you'll recall with the lift button, it took us some days to identify that being where we thought the transmission had been was most likely. Sometimes these things do take a little bit of time, but the bit that I take comfort from is looking at the timetable of when these cases were infected and infectious. and the genome sequencing, it would suggest that there's not a large chain of transmission out there that we haven't picked up.
I understand that you're still waiting on advice around N95 masks, but nurses are advising that they feel unsafe and may take action. Is that a big concern?
Look, like I said, it's something that we're looking at, and as soon as we get that advice, we'll talk more about that.
And is it acceptable that people with Chinese-made phones are having to request the beta version of the COVID Tracer app in order to scan